Okay, well, welcome to our Val Lab chat series. We are live from San Francisco. We are trying out a new technology, well, at least new to us, the OWL, to see how this thing will operate. The way we run these things is that the first 30 minutes or so are off the record. Since we're starting a little late, we'll go a little later into Minnesota time, 6:35. No, it's right into dinner time. So now we record the first 30 minutes, and then the next 30 minutes goes off the record. I know some people want to put bourbon in the room or something else like that, so always looking at me strange, but I'm sorry. So for those of you who know, my name is Pete Parenti. I'm a professor in finance. I'm joined remotely by Tom Gunderson, my co-host for these Val Lab chat series. Fortunately, Tom can't make it to San Francisco, and he's already told me that I have to MC this thing. So thank you very much to Tom. So and he's there for standby when I lose my way. So first of all, I just want to thank Chris Mulvanny, one of our illustrious alums from our industry MBA program, and done a lot of stuff with the MedTech area. Thank you for hosting us here in the Transamerica Tower. So I've never been in this tower before. That's super awesome. Say a little bit, what are you doing now? For all of you, just to introduce like your names, we'll go through this thing, and then what year you were in the lab or what tie, and then where are you now?
Yeah, well, first, I wish I could bring you guys up to the top of Transamerica because it's a rare site and you actually do feel the movement with the wind and everything. And I know it's an iconic location, so wish I could, but maybe next time.
Yeah.
So I'm a vice president in investment banking here at BTIG. We're a middle market investment bank. I specialize across healthcare within biotech, pharma, medtech, diagnostics, and then what is kind of a catch-all these days, the digital health. Healthcare IT, healthcare services, provider payer, tech-enabled services, et cetera.
Awesome. Josh.
Yeah, hey everyone, Josh Sopeth. I was Carlson MBA 2016, spent I think both of my years doing all things Millie in the Val Lab. I haven't worked for the Millie group at one point in time, so lots of ties in with the university. After that, I moved out here to the Bay Area. I work for a company now. That's a startup called TruePill. What we do is medication home delivery. So we basically ship medications to consumers. What's unique about our business is we are a B2B only business. And so we support many of the other digital health companies, brands, large payers. Probably the biggest known company that we support is UHC from and UHG broadly. We also support things like the Mark Cuban Cost Plus Drug Company. So that's what we do.
Cool. Thomas.
Yes, hello everybody. My name is Thomas Cloyd. I am a 2018 Carlson MBA grad, and I did Millie a year and a half. I was there and was a fellow, and it was fantastic. Had a great time. Born and raised in Minnesota. After graduating, I came out here to San Francisco, to Oakland actually, and took a job with KP, Kaiser Permanente, little place that I actually hadn't heard of. Really, until I came out of here, which now it's just ubiquitous around here. And I was on the corporate strategy team there, so which was pretty great because it's a large 95 billion revenue nonprofit. Funny. And it was fantastic.
Remember, we're on direct.
Yeah, no, it's great. And I totally work there. No, honestly, it was a great place to be and really learned a lot across the board. And then recently, about a year ago, I moved to Amada Health, which is in that digital health world. It's digital therapeutic is kind of the sector that we define it as. And there I'm kind of an account manager working with our health plans, many of which are in Minnesota, actually. So it's been great, learned a lot, and excited to be here.
Cool. Thanks, Thomas. Dr. Jenny.
Oh, hi. So I am Jenny Woodbury, formerly known as Jenny Hong. I graduated as a full-time MBA in 2014. I was integrated with the Millie program during that time. A little bit of a circuitous path. I finished my medical school training prior to coming for a full-time MBA. And my interests were in nonprofits and working within the healthcare sector and trying to figure out where I would quite fit in there. I returned back to medicine after graduating, started with a year in obstetrics and then switched over to anesthesia. And then now I'm an obstetric anesthesiologist. Was in private practice for a little while and did a lot of operational efficiencies and working within the hospital systems from the OR standpoint. And currently I am an assistant professor at UCSF, integrated with our faculty. I'm very much integrated with the operations and OR efficiency, so kind of looking at the business management of things as much as looking at quality improvement. And then hoping to start to bring in some nonprofit and some global health initiatives, and hopefully providing some more low tech or high tech, low cost devices, hopefully, as we do some more international operational stuff.
Very cool. And then, and also joining us, unfortunately, not in person, but by the cloud, Adrine Chung. Adrine, you,
Hi.
introduce yourself, how you doing?
Hi, I'm Adrine Chung. I graduated from Carlson in 2011. Seems like a lifetime ago. My first semester, I had a Millie course, and my last semester, I had a Millie course. I've been with Millie during that entire time that I was a part-time MBA. Upon graduation, I joined the Finch Fellow, Mike, hi. So it was one of the Millie Fellows for a year. I was working, so born and raised in Minnesota as well, but was working at Mayo Clinic when I was recruited out to California by City of Hope. I was overseeing the 3 site cancer centers for Mayo Clinic when City of Hope brought me out here to work on their integrations as they were doing a lot of acquisitions. The project I actually got recruited for just came to fruition after I left, which was the acquisition of the Cancer Center Treatments of America. And before that deal was finalized, I actually ended up transferring to a small site management and contract research organization called the Translational Research and Oncology Trio. It is a global company, but I was tasked with heading up the US office and creating a boutique CRO that focused just on startups and first in human studies only, because it's a lot more cost efficient if you have a dedicated team than to get lost in the larger CROs. What I didn't expect is for one of the larger clients to then recruit me out. So as of May, I transferred over to work for the 2 main startups that are actually run by the same management company. It's the same group, but they're 2 separate startups. One focuses on small molecules. The other one is based out of a lab out of UCLA that creates targeted antibody therapies. And so I've been immersed in that since May, working as the head of the clinical operations for both companies.
Very cool. So first, it's just wonderful to see all this. It's sort of like a family reunion of sorts. After this is Fast and Furious 10 is coming up, and we all know this. Those movies are all about family.
And I mean, that's the motto of my life. I live it 1/4 mile at a time.
I knew I could rely upon you for at least 12 film references. Thank you. Thank you. So the one thing that's sort of interesting about this Val Lab is that it technically is the Global Medical Valuation Lab. And I think as some of you know, I'm the Associate Dean for Global Institute now. And although we are in California, that may feel like Minnesota foreign country, is really not. It's still technically part of the United States. But one thing I've been finding in the role that I have just academically is that one thing we try to do by having all of our MBAs now undergraduates have a global requirement or something overseas is to deal with ambiguity. And I guess one question I sort of wonder, as you've all been going through your careers, I know this is unscripted, so take your time to think about these things, and then we can dive in. Like, how have the Millie courses or the Val Lab helped you with just deal with ambiguity right in your face and give you maybe some template, a structure, an idea, something to kind of cope with it or bang your head against the wall? Whoever wants to go first. Thomas is nodding, so it sounds like he wants to actually.
Yeah, that was a nervous tick, but I'll take it. No, I actually think about that a lot because you hear about the word ambiguity quite a bit when you're in business school or probably in grad school. And at that point, I'm like, oh, that's just kind of a buzz term maybe, but I certainly have faced it in a lot of ways. And in preparation for this, I was thinking how Millie has helped me. And I think for me, it is understanding Millie, the program itself, especially the Val Lab, helped me understand that there are so many different stakeholders in healthcare, and that you can get so granular and so specific that every stakeholder will almost be bespoke and unique. But the way to approach that is by understanding nobody has gotten to be an expert without asking questions and just kind of going for it. And so in the research we would do in the Millie Lab, you would go in, look on the internet, talk to experts, do what you could. So you got to that level of expertise where you could understand a base level and start having conversations. So I guess it's really confidence that you're facing things that seem daunting. But with research and just relying on your own intelligence and resources and experts, you can get to a place where you can understand it. And I think that confidence allows you then to really start learning it moving forward.
Yeah, I'll add on. I think working in like a startup environment in particular, you're probably faced with ambiguity like a lot of the time. And so I think as I think about most of the stuff that comes across my desk, that's structured problem solving and the steps you take to go through, analyze, digest, make sense of something that's on your plate, and then just going off and doing it. And so I realized like almost everything can be broken down into like a smaller problem or a piece of a problem. And I think what I've learned and put together through Millie and through the Val Lab is how to think and actually structure the way you solve that problem. And so whether it's frameworks, whether it's whatever you take away, there's a way to take something that makes no sense at first and then break it down into smaller pieces that really make sense. So problem solving is what pretty much almost everything we do is.
Adrine, something to chime in with?
Yeah, I think along the same lines, especially in my field, not asking questions is very dangerous. So knowing when to ask questions is very important for what we do. And with the Val Lab, I think it gave me kind of a framework to think about what questions are out there, what stakeholders do I need to consider, things that wouldn't have been obvious from the had prior to the Val Lab experience. So I think kind of building off the problem solving and what Tom and but we're all chiming in on is the same thing is it gives you kind of a different way to approach a problem and figure out how to comprehensively attack it and think about all the considerations that need to be there so that you have the right answer or the right solution. And beyond that too, for me, a great value of the Val Lab was also the connections and understanding that it is a team approach, that you do have to leverage experts in the field or experts in their respective disciplines to come up with a more comprehensive approach to what you do. And that's, for me, the most valuable thing from the Val Lab was working with engineers in the group, working with those that didn't have a science background or didn't have, a background in this work, because everyone came in with such a different perspective. And so it kind of helped prepare me to look at what kind of stakeholders are going to, perceive the message or understand what we're talking about and what kind of questions they're going to have, so I can preemptively think through, how we would address that. And being in the startup now, it's odd because it's been over 10 years since I was in the Val Lab last. I'm finding myself thinking more back towards the experience in the Val Lab being in the startup environment than I ever have in the previous jobs that I've had. So it's, it stays, and it's definitely giving me kind of a framework to work through that ambiguity and having some confidence that I'm making educated guesses. And if there's a misstep, it's a misstep I can recover from.
Okay.
I feel like I deal with ambiguity every day. And to be honest, I think, as everyone has also mentioned, for me, I take the perspective of curiosity. Really trying to understand, everyone's there really wanting to achieve the same goals, trying to figure out some solution, and then understanding how to get people to the table so that they can bring their best expertise forward. Oftentimes for me now, my work environments are not necessarily with very different thinking individuals like engineers and then people who are writing patents and et cetera. It's mostly within the healthcare field where we're working on trying to achieve this one end goal for a patient. And just trying to figure out the values and how that teamwork works is also something that I felt like happened in repetition as we were going through projects. So these projects are a little bit smaller, more impactful for an individual in the quality of experience that they have in the hospital. So it's very translatable in that regard. On the flip side, though, it's really interesting, even having a medical background and then having exposure to some of these medical devices. On the other end, I'm starting to see some of these devices that were previously like, when are these going to come out? So I'm actually talking to people about the Watchman, which was coming out at the time in which we were starting the Valuation. And it's now a discussion point, not a HIPAA thing right now, but for my uncle. So, and it's really interesting because now I have contacts over at Medtronic. I have contacts at other places where I can talk about the technical engineering components. And then all of a sudden the clinical aspects as we have more data. And so having that lens and seeing how that process has moved forward and the advancement of these devices and how it's really changed people's lives has been something that always catches me off guard. I'm constantly in awe of all the amazing minds that have come forward to help us become a better human race, I guess. Yeah.
Very cool. Mr. Mulvanny, professor.
I think I probably have like 30, 40 examples I can give you right now of ambiguity, but
How many with film references?
Bueller. The ambiguity that I deal with is more along the lines of what should we do? The early startup example that I can give you right now is that there's IP for a company that's looking to be a cardiac device, but yet they filed IP also to be an oncology device. Those are two different types of investors when you really go out there. So the ambiguity there is what do we do? I'm not a consultant, right? That's not what I do. I'm not going to do what you guys are doing with the Valve Lab, because what's important is how you guys align the IP, the market, the regulation, and the actual pricing, the revenue strategies, right? They all have to kind of come together. And I think with what we're all saying is that it's a puzzle, and you kind of have to take on what that puzzle is. You have to give the effort. And the one thing that I want to be, I guess, a little bit more forward with this is that one thing that I learned within the Carlson MBA, but more with Millie, was we kind of take our own responsibility and really asking those questions and going to go figure it out. So the ambiguity is more of like the challenge that we're going after. And I think that that's one really positive thing that we're taking away from this.
So I want to leave some time while we're on the video record for folks to ask questions. That way you can all have your Instagram moment and be broadcast forever and a day.
It's TikTok now.
I'm not allowed to talk about that. Check out my bios on ProPublica. So anyway, keep recording. So if you were to give one piece of advice, each one of you, to like these future students or the faculty that have to teach this thing, what might it be?
Okay, I'd like to go first.
Sure.
The one thing is whoever you're working with on this project in a group or who the client is, as best as possible, really understand what you're trying to solve with there, right? You're doing this as an academic exercise, but as best as possible, try to take the academic exercise and relate it into the real world. For example, I used my Millie example when I was interviewing with Abbott many years ago when I was doing my MBA, and they were blown away. They thought that this was the most revolutionary thing they've seen from an MBA student. Yet there's 7 or 8 or 9 programs, I think, that currently do something like this, but it's unique here because of who's training you and what the process is. So my piece of advice is leverage your group and your client and the project all together as you go forward in your next opportunity.
Adrine?
I think on the similar lines, I was going to say, I would not consider this as an academic exercise or something you just need to do for credit, but to take it as seriously as if this was your job, because it could be something that translates very much to your career and your future development. I think it's great advice.
Jenny?
That's what I tell my residents all the time. Pretend like you're going to be the one that's going to be running the project and doing the next thing. Your decisions are valuable. And it's a really safe space to also make mistakes. Learning from each other, using your resources and allowing yourself to be humble in that process, I think is a very difficult thing to actually do. But knowing that those failures can only help you to hopefully not make them in the future and maybe become better is also very valuable.
Thomas?
Yes, these are all great. I think a different tack I would take is empathy, and really leaning into it in these projects. As we said, there's different roles you play in the policy, the marketplace, all that. It is a unique opportunity to really lean in and understand what that is. So in the future, in your career, you may be working in a role specifically like that, and now you have that experience. And it's just a chance to kind of put on that mask, see through those eyes to see if it's something you're interested in. Or in the future, when you're working with people in those roles, you can maybe have a better understanding of what their life is like, which I think is valuable.
Gosh. All right, I guess I'll go last. Everyone has so many good ideas here. I'd say maybe the one thing that I'll add on to everything people have said so far is treating everything like a learning experience and learning from everybody else's perspective. I think that's something that regardless of what career you go into, you're going to be working with people in some way, shape, or form. And so you may not always agree, there may be conflict, you may not see eye to eye at all times, but figuring out how to approach and work together and get through some of the tough times with some of the people that you're working together with. That's something you're gonna have to do forever. And so I think as much as you can figure that out in a safer place is a good thing to do. So that's what I'll add on to it.
The final round of questions to the group, and then I'll open it up, so get ready to ask your questions. What would be your top pick for a karaoke song? Just so we're clear, the patio next Wednesday, karaoke is back.
Wonderful.
Yeah, I know, but it is safe space, as Josh said, you don't have to come out to sing, but I mean, just if you were to come out to sing.
I participated in high school sports and I went to an all boys school. And so we actually had to do a karaoke event in front of the team. And so I think I sang Eye of the Tiger.
Oh,
Which I'm not sure would be the most fun karaoke. I think probably my karaoke choice would probably be probably one of the Journey songs.
yeah. Josh,
I think I would go with, like the late 90s boy bands and maybe do like I Want It That Way. Usually a crowd pleaser. So I think that's where I'd go.
okay, Adrine, with that cackle, you're up next.
Oh, boy. I mean, I echo the 90s there. Geez, what would I sing? I don't think anyone wants to hear me sing. Probably, and the only reason for it, My Heart Will Go On by Celine Dion, because I can do somewhat of an impersonation of Celine Dion. I will not demonstrate it now, but that is my superhuman choice.
Yeah, your plane ticket is being Venmo'd now.
Yeah, she has the interwebs, like this is an open opportunity. She doesn't even.
Yeah, someone on your phone, cue up the chords, Anyway, sorry, Jenny.
I think I would have to do Queen. And the question is, which song? We're the Champions. I don't know.
Under Pressure.
Under Pressure, Bicycle. Yeah, there's just so many options on there. So I would have to be in that genre.
Thomas?
It's good. I think I'd do Gangster's Paradise, Julio.
Ah,
It is, yeah.
Good know where people will be on next Wednesday. So with that, we're still recording, but let's get some questions in from the group here. The owl should pick you up, but just in case, speak with a good voice so the owl sees you and picks up your question. Go ahead. Introduce yourself. Yeah.
Johnson,
Yeah.
first year MBA. What are some of your favorite projects that you worked on?
I got one that immediately comes to mind. When I was at KP in corporate strategy, a lot of what we did was scanning of the marketplace. So again, similar to some things you do. And it was incredibly exciting and interesting because senior leaders were interested in what we were doing and acting on it sometimes. And so just kind of experiment and look and see what's going on and theorize on what could happen was really fun and felt impactful. So I really like that.
This is actually a great question for me, and I'm really excited to answer this because this is like my crown jewel thus far in my career in banking. I did the fairness opinion for a company called Humacyte. And the interesting thing about that is that this company, the product is sold like a medical device, but it's regulated like a biotech. So think about that a little bit. Sold as a medical device, but the regulation of the manufacturing, of the operations, and of the regulatory approvals or biotech. And so my specific job of a fairness opinion is to say financially only, does this make sense? That's all I have to answer. The way that I went through that process actually triggered a phone call through a regulatory agency that said, this is very interesting. How did you come up with this process? And I answered their questions. It took probably like 30 seconds and they said, thank you, you're done. And the senior that I was working with on the project said, I've never had that happen before. That's a great thing. It's a great thing that you did that. And so that's, again, my crown jewel thus far.
I'd say that my favorite project I've worked on so far, so we were working with a customer who was at True Pill, and they came to us with like, we kind of want to do this thing, which was we want to virtualize at-home biometric screening. So if anyone's gone to like the on-site clinic day where you get some blood drawn, you get your blood pressure done, they're like, that's what we want to do. And they came to us and were like, you help us do it. And so we went through about 6 months of mapping out a new product offering for them to launch and do that. And then I got to see it all the way through to launch, and now they're selling it to a bunch of employers. So, which makes a ton of sense with like the remote workplace, and the trends like are pointing to that. And so it's a pretty cool thing to follow that all the way through to launch.
Cool. Jenny?
Mine's very medicine based, so not necessarily related to a specific technology, but I think one of my favorite things is to change human behavior without them really knowing. So yeah, so I'm a bartender, like that's what I do as an anesthesiologist. And one of the things that we have to think about are like, lots of different meds to kind of help people go through an operation safely. But one of them is antibiotics, which I think is very much something people care about, infection risks. And so we have an old school thought that was brought into, practice 20, 30 years ago, and you put a whole bunch of dogmatic positions together. People are really reluctant to change. And we found that basically, hey, we're contributing to more multi-drug resistance, skin flora. So penicillin allergies are classic. So if you guys have a penicillin allergy and it's from your childhood, it is unlikely to be an allergy now. And that was a very hard concept for people to understand. And so you have an aging population getting knee replacements, people getting shoulders, hips, now doing all sorts of interesting scopes. And you're like, why are we going for this big gun medication called vancomycin when we can actually do some testing and try to use better drugs? And so the project that I did as a resident, and then of course went all the way through into my fellowship, and when I was a part of an attending position at University of Colorado, was to basically educate, instill behavioral change, incorporate it into electronic medical record systems, talk with the PNI, or the pharmaceutical pharmacology group, overseeing group at the hospital level, and then instill like also an allergy testing opportunity. So having a full circle effect in terms of ensuring that we kind of wash this idea of using penicillin allergies as a legitimate allergy in people's medical records, and allowing them to use better medicine-based practices without them really thinking about it.
Pretty cool. Adrine? You go.
Sorry, I was on mute. Yeah, so I guess for me, it's a toss-up between two. So probably the one that still lingers because of just the learnings was as part of the kidney allocation policy process when the last revamp was done. And I was part of the sister organization to UNOS, and we had a large committee that had been assembled with scientific leaders, clinical leaders, and in putting this together. Didn't expect that ageism was going to be the issue of the day, and ARP was threatening to sue. So that process was quite interesting. I learned a lot about how policymaking works, and how that impacts what's happening at the patient level, how kidney allocation was just, and really we went into liver right after that. So just that project for me was near and dear to my heart because of the challenges and all the learnings and the different moving pieces that I don't think I'll ever get exposed to again, being in the field that I'm in now. The other one is during COVID, City of Hope developed its own COVID vaccine. And to me, that was a very special project because we were targeting the immune compromised population for developing the vaccine. It was recently, I think about a year ago, it got licensed to GeoVax. So it's doing very well, but I was part of the original team working with the scientists, working with the clinicians and putting this vision together and getting it launched. We had a prototype in I think it was like October. And then we launched the clinical trial in December and was completing, we had completed the first phase by February, which is just unheard of for the timelines for clinical trials. So it's a project that's near and dear to my heart too. So 2 favorites.
Time for one more question. Anyone from the group? Actually, we'll do 2. Sheen.
Just a question on my side. In general, healthcare system and what you think in your.
You have to introduce yourself though.
Sorry?
You have to introduce yourself first.
Oh, yeah, sorry, excuse me. So I'm Isa and I'm part-time MBA. I'd like to have maybe your vision about, we develop lots of innovations to cure basically disease or to treat and solve problems that are currently existing. I think that we do very less in terms of prevention in general, healthcare system. And we see that lots of states are more willing to invest in prevention. I come from Paris, from Europe. So we see that the budget is trying now to be relocated to more preventive solutions. I'd like to have your thoughts about what do you think that there are more inventors right now that are shifting to create more preventive solutions? Do you think that it will get a good receptivity or it's something that would be more developed in the future?
I guess I'll start with that. So big believer in that. Problem that I won't directly answer it. I'll kind of answer it from the periphery. The problem with that is how you come up with the reimbursement strategy and how you come up with the revenue strategy of what you're doing. And that's why the direct to consumer pathway is a growing pathway that's happening within what I'm seeing within healthcare IT and digital health products, because they're hoping that changes actually the behavioral side, right? That you can nudge something or proactively do something. From the innovators and entrepreneurs that I've been around, that's constantly kind of an asterisk question or a gold star question that's off to the side of what are we trying to solve? Because anytime that you can invent something, create something that's looking to solve something, in addition, figure out a way of how to proactively get ahead of it before it gets to that solution. I mean, I understand you're kind of cutting off your nose at that point, but still it's more of a topic of conversation these days. And I think it's going to keep growing.
Yeah, I think that just to reiterate the 2 key things that I think Chris said is how are you getting paid and will people pay for it? And how do you attribute the value that this solution is providing? Because you can say a bunch of different things, but if you can't directly tie and attribute your intervention to money savings or whatever, it's going to be really hard to make a case to have someone pay for it. So that to me is like been the biggest challenge. And then I think the other thing that both Chris said and Jenny said earlier is like, how do you make it easy to change behaviors? And is there a way to do that and not type reimbursement? I don't know. So it's, to me, those 2 things need to come together for those types of solutions to actually make it in the market.
And I totally agree. So Amada actually works in preventative care and management of chronic conditions. And I think it's moving in the right direction. I think for those same reasons, people are recognizing that there is an impact to make. But adding on to what was said, and I totally agree, not only do you have to prove that there's ROI there, are you decreasing utilization, whatever it may be, medication use, but is the customer you're talking to actually responsible for those savings, or is it one of the other stakeholders that are in the game? And if so, how do you actually show the value to all of them together? Who may it be? So that I think is the really hard part, because now you can show that there is a decrease in utilization, a decrease in medication, but okay, is this health system going to be seeing that down the line, or is it the health plan? If the health plan's only seeing somebody every year, do they care? So I think the who sees the savings and how to prove that will probably be the big challenge, because I think the technology is here and I think people are hopefully ready.
I've never viewed healthcare in as much as this is all about stakeholders who are trying to make a profit and etc. It's really hard to know how to bring that altruism in terms of trying to elevate population health without compromising total healthcare expenditures. and it's in this country. Like, it's just how it's built. And as you were mentioning, as you invest in a product, you try to underutilize, and then in turn, you're taking a piece of the pie, or someone else is taking a piece of the pie. That money is still going to be there. It's the same idea with, this is a simple concept, is that if you build it, they will come. So hospitals build more beds, more patients show up, more operating suites are available, more surgeons will do more operations. There will always be an opportunity for some benefit to some party at the expense of something else. So there's a definite exchange. So what does that look like? And I've seen really great efforts done on local levels. And it really is communities coming together, businesses coming together, hospital systems, insurance companies, knowing how to come to the table in small microcosms of whatever goals are in that community with leaders that are speaking at. And then there's definitely other areas where those things are not of value. And so then you're starting to interface on larger like healthcare policy. So it is an incredibly challenging thing. I must say, like places like Kaiser Permanente, it's like one of those things, like places where you have everything kind of encompassed, so you have a lot more control about your inputs and your outputs. As do some certain countries like England, right? So they have true input control from even a higher level, which doesn't happen in the US. So complicated question. I would love for us to do more preventative care. It would make my life a lot easier too. Patients would not be as sick, and there would be less complications, less hospitalizations, morbidity, mortality, all of the above.
Adrine, quick thoughts?
Yeah, so I live and breathe in the cancer space right now. So for us, prevention is one step, but just as important is early detection, where we have something that we can action. And so, there's a lot more interest in early detection in our space, mainly because of the factors that really drive the cancer. It's not always preventable through environmental factors or changes in lifestyle. They absolutely help, but that's not, always the crux of things. And especially with individualized medicine and how specific we're getting with the way we're targeting cancer, so that we have less adverse effects in patients and help prioritize quality of life and not just blast every cell. It's that much more important that we stress the diagnostics as much as we stress the treatment. So I guess for me, the preventative measures are important, but also early detection where simpler or less invasive intervention can take place as just as important. That's, from the perspective coming from this space.
And one last question, I saw him go.
Do we have time?
Yeah, sure.
It's really a question about decision making. I think.
Got to introduce yourself.
Oh, that's right. Hi, I'm Ryan Hawk. It's a pleasure. We all really thank you guys for your time and being here and letting me go over. So anyways, question about decision making. Seems something that you all agreed upon was the sort of idea or philosophy of treating these opportunities like the Millie Val Lab as if it's real, right? That really resonates with me. It's something that I like to do. It's look at the academic process as a great opportunity to learn and make mistakes instead of just trying to get the A by doing what the group did last semester, like actually try and learn and think through the process. But thinking about graduating this spring and leaving and moving into a career, I think a big concern for me is you don't have that parachute or safety net, a professor looking over your shoulder, the industry professional that gives their time late on a Friday and lets somebody talk too long. How do you make that decision as you move into your career when it's you who have to make the assumption or choose what piece of information is the most important to include for that first, second, third time that you take that full ownership on your own? What's that like, and how do you overcome that?
That's a real big question. It's real difficult because, and this may come off pretentious, but it's not intended to be. The mistakes that happen in my industry are significantly problematic. And so we have multiple revisions and review systems in place to check the work and go through it, because imagine we're $2 off an IPO price and it's public now, and a company just lost out on X dollars. How does that impact the shareholders? How does it impact the company? How does it impact the prospects? That's just the most massive error you could ever make. So I kind of swallow it, like it's difficult. You just got to rely upon the system that you're a part of, and that there's some type of structure or framework to it. That's the best thing that I could probably say for my industry.
Yeah, I think I'm in a very different industry where mistakes are a little bit more accepted. I would say it's a lot of it's like limiting, I guess, or figuring out or reducing uncertainty as much as you can. And so you're never going to have perfect information to that ambiguity question earlier, but how can you feel as confident in what you're presenting and going forward with it? Because I think as much as you can figure out, I know all of this, I maybe feel pretty good about some of these, something's still, out there and uncertain. And so, yeah, you kind of just have to go through that thought process and basically try to reduce as much uncertainty as you can as you try to make that big decision. So I don't have millions and billions of dollars on the line when I make a mistake, but it's the same kind of thing. And then I think the other side of that is when you miss or you are off on something, what do you take away and learn from that? And how do you build that back into the process? And then how do you communicate that, whether it's up through leadership or down to a client or whatever it is, and have a way to explain what went wrong if it does go wrong, and hopefully it doesn't.
I think self-awareness is just as important in being able to be aware of what your strengths are, what your limitations are. And as mistakes happen or as you're taking risks, you at least have a foundation to know what types of risks you really should be taking or what you can't really handle. So, learning from your mistakes, it's easier said than done. A lot of times people don't fully reflect on what their ownership was in that mistake, what could have been done differently. And yeah, so I would say, being very clear on what your tolerance is for risk, but also understanding what your strengths are, knowing yourself and your limitations is critically important in making those decisions.
I have one quick specific one is for me, finding somebody who has a counterbalance thinking process or mindset than you, that you trust and you can do a quick gut check with. And of course, other processes that exist can follow through, but if it's different personality type or whatever it may be, say, hey, here's my thought process, here's the outcome. Does this make sense? Where are the gaps? What might it be? Depending on the size of the issue, it can be a more intense process, but that's certainly something I do. There's 2 or 3 people that pop in my head where I'm like, hey, here's the outcome of what I'm talking about. What do you think? Where's the problem here?
I always reframe how people should perceive. Mistakes happen. Like I'm a mom, I'm an educator, like you're gonna make mistakes. Like just face it, it's gonna happen. What matters to me is what you do when you make that mistake. And that is by far the biggest takeaway that I have to offer to people is, what is the next process? Like, who are you gonna, are you gonna admit to your mistake? It's gonna be hurtful. What are you gonna do to make it right? Does it mean that it could be something big like losing a job? Yeah, but that's another piece of experience that you bring forward when you go somewhere else. And I think being honest, building humility, understanding limitations, the self-awareness that Adrine mentioned, like all of that is incredibly important. And as you get more elevated into these higher roles, as you're moving up into different communities, like it's so important to know that someone started where you were at one point. You build a mentorship process, allow people to use you as a person that they can look up to, right? Like make sure, try to build that community so that, the system's in place. That system should be a community working towards a better outcome, not to tear people down. So if you take a different perspective, sometimes you build the culture that helps you to become better.
Well, thank you all for this. We're going to close the on the record version of this and then kind of off the record, but it's really just incredible reflections from all of you and Adrine. It sounds a little weird, but I'm kind of proud of all of you. Just seeing how you've all gotten into your roles and grown into them. It's really cool to see. So are we off?
And thank you to Chris.
Thank you, Chris.
You're welcome. But I think you guys, between Steve, Mike, and Jessica, what you guys continue to build, continue to do, and what we are doing here and what you guys are doing now, I think you guys are doing just a tremendous job, and we thank you for it as well.
Put that back on.
I never.
Yeah, well, appreciate it.